Okay, this video is what is the best diet for spinal cord injury patients? SCI is spinal cord injury. Okay, so basically, spinal cord injury patients are complicated. Most commonly one thinks of a post-traumatic injury, but it also includes patients with rare diseases like ALS, amyotrophic lateral sclerosis. It includes patients with multiple sclerosis. And these patients are going to have different needs. There are going to be patients with different levels of spinal cord injury. Some are cervical cord injuries. Some of them are more like thoracic cord injuries. But the reason why I'm giving this talk is there's some basic principles in nutrition that are valuable for anyone to know. And I just went to the literature, the medical literature, and here's a paper about primary care providers' guide to nutrition for spinal cord injury. Okay, and then here's another paper about nutrient intake after spinal cord injury, comprehensive review, and practical recommendations. And the reason why I'm showing this is these guys writing these papers, they don't know what they're talking about. This is an embarrassment. This is a disgrace to modern medicine, how ignorant these guys are. So listen to what, I just want you to hear this. So doctors, unless they do additional specific extensive training in nutrition, they don't know what they're talking about. And I've seen similar problems coming out of like these, head injury recommendations coming out of Boston and Harvard affiliated hospitals. They're idiotic. They're stupid. Okay, so I want you to see this. Listen to this sentence. Now this comes from these are big papers in these fields. Encourage heart healthy diet with low fat dairy, a major cardiac risk food, poultry, a major cardiac risk food, fish, a major cardiac risk food, and then nuts, a bad idea for coronary artery disease patients, okay? Salmon, for example, is 50% fat, calories from fat, and 50% calories from protein. That's a terrible food for preventing heart disease, okay? I show you this just so you have an idea what's out there and you don't immediately defer to somebody just because they have a title. It doesn't mean they know what they're talking about. Here's another paper, and this one recommended olive oil for a major problem in spinal cord injury patients is obesity, okay? It's difficult for them a lot of times to exercise much. They got decreased muscle mass from the spinal cord injury quite often. So the last thing they need is to get fatter. If they get fatter, they're more prone to decubitus ulcers, and those can be very troublesome. The infection from the decubitus ulcer can spread to other locations in the body, including the spinal canal. They're also prone to infections, bladder infections and whatnot from neurogenic bladder and whatnot. Now, they are complicated. Some of them cannot eat as much fiber. Some of them are sensitive to some foods, like spicy foods, for example, some especially caffeine, for example. So there are special unique issues, and each patient has to be treated as an individual. But there are general principles that are true. If you want to be skinny, then you should eat food that makes you skinny. Olive oil, all the oils are liquid fat and make people fat. And this paper is recommending oil to feed to these patients. That sounds rather stupid. There's also recommending fish. We just talked about how stupid that is. Chicken is one of the most commonly associated with fat foods there is, and they're typically loaded with estrogen to fatten them up quickly. They're often high in arsenic. Okay, then they're recommending eggs. Eggs is what you feed to animals to cause coronary artery disease, to raise their cholesterol levels, okay? 1% milk has tons of fat in it. It's based on the weight of the milk, not the percentage of calories. That's tons of fat. Cheese is a terrible food, okay? Nuts are not as bad, certainly, but they're still not a good idea. Esselstyn recommends 0 nuts, okay? When they say sodium, they say try to get your sodium below 2,400 milligrams. That's still a ton of sodium. That's more than 10 times higher. Well, I wouldn't say always. Some people are eating a little more than that in natural environments. That's still a very high amount of sodium compared to a natural plant-based diet. Okay, and then the same article recommends try to limit saturated fat to 5 or 6% of calories. How are you going to limit saturated fat to 5 or 6% of calories if you're eating fish, poultry, eggs, milk, and cheese? That's not going to be doable. That's just stupid. Okay, and then it says you can have red meats but limit them. Okay, trim the fat off. That's ridiculous. What I'm trying to say is the person's writing these articles should be embarrassed of themselves. This is so stupid, it's not even funny. It's just completely stupid. It's like a person who's an ignoramus. They feel good when they recommend something similar to the Mediterranean diet, but they don't know what they're talking about. Okay, I'm going to talk a little bit more. We don't got a lot of material on this, and I'm not a spinal cord expert. I make no claims to be a spinal cord expert. I simply know some general principles about nutrition. And it's not good for anybody to be obese. When you're obese, you're more prone to having pressure sores. We call them decubitus ulcers. You're also more prone to all the complications that go with being fat. You get increased high blood pressure, increased diabetes. That leads to all kinds of problems, increased atherosclerosis, heart disease, coronary artery disease, and stroke. You get increased kidney stones just from being obese, but also animal protein is a major risk factor for causing kidney stones. High dietary sodium, risk factor for calciuria, calcium in the urine, increased risk factor for kidney stones. Caffeine is associated with increased calcium excreted into the urine, more kidney stones. Industrial fructose, like the high fructose corn syrup for sweetening a lot of processed food, also can increase serum uric acid and it also increases sodium absorption from the gut, so it can increase the risk of kidney stones. Okay, when somebody eats a low-fat vegan diet, they've got better immune function. Like we said, some patients can't have that much fiber and they have to titrate it and figure it all out. They can eat plant foods that'll have less fiber, okay? For example, white rice has less fiber than brown rice, okay? Because you remove the outer part of it where most of the fiber is. They should get some sunshine for all the benefits of sunshine. Being well hydrated helps decrease the risk of kidney stones and also decreases the risk of constipation and fecal impaction. Adequate dietary fiber helps prevent that too. And again, I'm not a spinal cord doctor and I'm not an expert in spinal cord patients, but there are, and they're complicated. Some are being fed through a gastrostomy tube called a G tube. Some of them can't even eat on their own because there's a high level of their spinal cord injury or brain neurologic components contributing to that, like some MS patients, some ALS patients. But there's still general principles. The lower the percentage of calories from dietary fat, the less fat the patient's going to be, and that's going to help them decrease the risk of decubitus ulcers, okay? The less fat they're eating, the less they're going to be prone to things we talk about with injury to the endothelial glycocalyx. Like, and I gave that whole lecture on myeloperoxidase and whatnot. So anyways, these are just some useful things to know. If you want to be skinny, you eat a low-fat diet. You want to minimize your risk of stones, you eat a whole food plant-based diet. And you can adjust the fiber as needed to the patient's particular needs. But these are the ways you prevent hypertension, diabetes, obesity, atherosclerosis, which are major problems in these patients. These patients have lots of problems with kidney stones as well. So anyways, I hope this is helpful to some patients.